on Talk Radio 640 WGST.
Talk Radio 640 WGST. 3:35, 25 before 4. I'm Rob Scott. Across the studio from me is a gentleman by the name of Ben Chodor. This is his show. It's brand new on Talk Radio 640 WGST. It's called, he tried to say, Health Tech Talk, which is really kind of tricky, and I like to think I talk for a living. Health Tech Talk.
Rob, that is so kind. My mom would be so proud if she was listening to the way you introduced me.
Well, you know, you're top drawer. All I'm here is just to kind of, sit in the boat and watch you row. The thing I was curious about, and I asked you this at the start of the show, every Saturday, by the way, folks, Ben will be here with you from 3 to 4. Health Tech Talk in a nutshell. What are you doing?
It's all about the collision between healthcare technology, big business, public markets. It's about the ingenuity that we have out, all over the world that is changing how we treat patients and how we interact with our patients.
It's not just a jar of aspirin anymore.
It's not. And it's about wearables, and it's about science, and it's about pharmaceutical, and as the last segment, it's about nerves, how now we can treat someone that, maybe 5 years ago or 10 years ago was going to be stuck with some pain, and now there's a way to do something different, and that to me is exciting.
Something else from my perspective, too. Sometimes I wonder about all the health things that, healthcare things, and sometimes I think this doesn't seem, it's too good to be true. You'll help point out some of that stuff out, too, in the future, I'm hoping.
Yeah, listen, there's been lots and lots of apps that have come out that said it can tell you if you have a melanoma. Guess what? It's not. There's not an app that's going to make your teeth white. That's not going to happen.
Right.
So we're going to cut through a lot of that too, but at the same time, we're going to bring you the companies that are really making a difference in the space. And hopefully at the end of the day, you're going to stay healthier, but maybe we'll also help with the saving cost of healthcare, because the costs of healthcare are insane.
And you're not the first one to tell any of us that.
That's right.
I'm looking forward to the show. 3 to 4 every Saturday, Health Tech Talk with Ben. And you've got a guest, I guess?
Oh, my God. I'm really excited for this guest also. I've said that in the last segment too, but what a great first show. I have Todd Johnson. He's the CEO of HealthLoop, a Silicon Valley darling. They've raised $10 million in Series A. So think about this, $10 million in Series A. They're part of the Apple Health Kit. How cool is that? Over 36,000 e-visits already, and I'll let Todd explain what that is. And I was one of the first people to download their new app. They're in the Apple Store, so they have a patient app, and now they have a physician app. I'm really excited to have you on the show. And again, everyone, it's Todd Johnson, CEO of HealthLoop. Todd, how are you? And thank you for joining us from San Francisco.
Thank you, Ben. I am great. And, hey, thank you so much for having HealthLoop on your show today. We really feel honored and appreciate it.
All right. I want to start off right away. Let the audience know what your company is all about, because I cannot give it justice.
Sure. In a way, it's just so simple. The healthcare system traditionally has gotten very good at optimizing its time so that it can see more patients and do more things every day and ultimately try to make more money. But as patients, what that's meant is we've had less and less time with our doctors, less and less time to focus on what we need. And oftentimes our visit with a doctor is just a few minutes, averaging 7 to 12 minutes.
Right.
And what happens next? And so when I'm a patient who is sick or injured and I've got something new going on, and I sit down with my doctor and he or she tells me, this is what's going on and this is what we're going to do, well, then what? And after I'm discharged, I'm given some new medications, a new therapy, some education, some information, but then what? And nobody's following up with me as a patient, and things go wrong, things go sideways, and who's watching out for me? So HealthLoop, the concept is really simple. It's a proactive platform allowing doctors to check in with their patients in between visits, to guide patients to make sure we get to the best outcome every time, make sure that the patient is empowered with everything they need to know and do to get better, and ultimately gets there with a sense of, I've received great service from my doctor. And we can talk a little bit more about it, but essentially it's visits in between visits between you and your doctor to make sure you're getting the best outcome possible.
So patient satisfaction goes up, patient engagement goes up. It's a win-win for everyone.
It is, and this is in an industry where, we've done a lot to advance medical science and medical technology, and there's a growing belief that patient engagement is sort of the next blockbuster drug.
Yep.
And so what do I mean by that? We're spending an incredible amount of money every year in healthcare here in the United States, and yet we're not getting the best outcomes comparatively to other developed countries. And what's amazing is that the Institute of Medicine in 2013 came out with a report that finds that about 30% of all healthcare spending is what they call wasted.
That's
so
right.
We're spending almost $750 billion every year on interventions, on treatments, on things that are duplicative, on things that if the right actions had happened, if the patient knew exactly what to do,
Wow.
exactly when to do it, and the doctor knew if they weren't doing great, we could save $750 billion a year.
Wow.
And so think of that in terms of if there was a therapeutic that could bring that $750 billion price tag down to zero, it's the engagement of individuals in their own health care. It's the engagement of individuals with their doctor and the systems.
You're right, Todd. So, Todd, two questions I got for you right away. I was reading through the site, and one of the facts that really sort of blew me away a little bit is that you had this age group of 65 to 75-year-old patients. They want to engage. So I would have guessed that wasn't the age group. I thought it would be like the 20 and 30-year-olds want to engage. Why does that generation really need to engage or want to engage?
Well, think about it. Anyone who's sick or anyone who is injured, they want their doctor.
Right.
And think about your own history or the history of your friends and family. When you start to have something that feels wrong, maybe the first place you go to is the internet. And Dr. Google is often telling us we have cancer,
right,
no matter what it is we have, right?
It's true.
But we need to validate that with the person we trust, our doctor. So what do? We print out all this research and we bring it with us, and now the doctor has to plow through all that with you.
Right.
So people are engaging, right? And when you're sick and you're injured, there's nobody you want more as a trusted ally than your doctor. And particularly for the aging, I think what we found, and we've got now tens of thousands of these what we call virtual visits,
right,
patients checking in with their doctors in between visits, and older people are actually more likely than younger folks to engage.
That's amazing, Todd. How do you engage with the physicians and patients? In other words, how do you win new clients, and how does HealthLoop make money?
Yeah, so I think have found ourselves at the very best moment in time for interventions like HealthLoop, where the incentives are starting to change. So from a physician perspective, the game has long been, how can I get as many tests, visits, or procedures in a day, right, to optimize my revenue? And the entire healthcare industry has been transforming with the assistance of the Affordable Care Act into what we call value-based care. So rather than paying for all the individual transactions, payers like Medicare and Medicaid and commercial payers now want to pay for a good outcome. Right. And the burden then becomes on the physician's team, right, to get to that best outcome as quickly as possible and as optimally as possible. So the incentives have shifted. And if you think about an assembly line, right, where you could imagine a microprocessor facility with sensors on it. There
Todd,
aren't any quality controls today.
I agree 100% with what you're going. But as we want to move this along, because I have a lot of we only have a limited amount of time. But really, how do we make money? So how does HealthLoop go out and get clients? How do doctors' offices find out about you guys and patients get involved?
Yeah, so physicians pay us directly for the platform to engage with their patients. Physicians win by having outstanding patient experiences, and patient satisfaction is driven through the roof, and better outcomes at lower costs. But we can help those patients. We've got commercial health insurers that are actually paying doctors directly when their patients engage on HealthLoop, and medical malpractice carriers who pay doctors directly when their patients engage on HealthLoop, because we know that happy patients don't sue their doctor.
Right. So I know a lot of hospitals and there's rules like if you leave a hospital and you come back in less than 30 days, you're going to get dinged. So this is a great way to keep the physicians engaged with their patients. So you're not leaving them after you clear them to go home or after they leave your office. You're actually doing that next step. You're giving them advice. You're giving them things to do. You're staying in touch with them. That's
right, and they're staying in touch with you, right? If you ask any patient if they want to be readmitted to the hospital in the next 30 days on their way out the door, the answer is pretty much universally no. So you're empowering patients with the tools so they don't have to come back either. Everybody wins.
So, Todd, we're going to be taking a break in a second, but I got one question before we let you go for this segment and come back in a couple minutes. How do people find the app, and how do they find your company?
It couldn't be easier. Go to healthloop.com. You'll find out all about us, and our applications are in the iTunes App Store.
Thank you, my friend. We'll be back to you in a second.
You're listening to Talk Radio 640 WGST, Health Tech Talk with Ben Chodor, his guest, Todd Johnson from HealthLoop. A quarter till the top of the hour. One more segment with Todd. Don't go away. You're listening to Talk Radio 640 WGST.
On the road, find us at 640 a.m. In the office, stream us at WGST.com. And on your smartphone, it's the iHeartRadio app. Atlanta's compelling talk. Talk Radio 640 WGST.
I'm Mike Roberts. I just rebuilt the engine of my 2008 Camaro. You should hear it roar. This engine wakes up the whole neighborhood.
Well, Mike, rebuilding a car engine can be fun, but I'm talking about a different kind of fun. I'm talking about working on machines with 60,000 pounds of pure thrust. Jets and airplanes. Those are the big boy engines with big boy pay for guys who fix them. According to BLS.gov, aircraft mechanics average over $55,000 per year. At Aviation Institute of Maintenance, we train airplane mechanics in months, not years. Earn your FAA certifications, master the machines, and then go to work for top airlines like Delta, JetBlue, United, American, and Southwest. Don't wait to start your new career. Call Aviation Institute of Maintenance today at 877-JET-JOBS or visit masterofthemachines.com. For gainful employment and consumer information, visit us at masterofthemachines.com.
Join host Ben Chodor every Saturday at 3 p.m. for Health Tech Talk. Technology is changing how healthcare is being delivered. Their special guests will talk about how healthcare, science, and technology are enabling patients the ability to take control of their own health. Join the conversation Saturdays at 3 p.m. Nestled in the Great Smoky Mountains in Pigeon Forge, Tennessee, Fireside Chalets offers beautiful 1 to 7 bedroom cabins for your winter escape. You don't have to spend all your time relaxing indoors. You can also go skiing, snowboarding, tubing, and outlet shopping. So book now and get the Winterfest special for January and February. Pay for 2 nights and receive a 3rd night free. Call 877-774-4121. That's 877-774-4121 and visit them on Facebook or firesidechalets.com. Certain restrictions apply and special excludes holidays and special events.
Thinking about life insurance? What if you could make one free phone call and learn your best price from nearly a dozen highly rated, price-competitive companies? Well, that's exactly what happens when you call SelectQuote Life. For example, George is 40. He was getting sky-high quotes from other companies because he takes meds to control his blood pressure. But when I shopped around, I found him a 10-year, $500,000 policy for under $28 a month. I'm SelectQuote agent Dan Savino, and believe me, if SelectQuote isn't shopping for your life insurance, you're probably paying too much.
For your free quote, call 1-800-949-1130. That's 1-800-949-1130. 1-800-949-1130. Or go to SelectQuote.com. Since 1985, we shop, you save. Get full details on the example policy at SelectQuote.com/commercials. Your premium can vary depending on your health, issuing company, and other factors. Not available in all states.
Kids are going to get bumps and bruises as they grow up. It's part of being a kid. But we can protect kids from serious injuries. Did you know that preventable injuries are the #1 cause of death for children in the United States? But the thing about preventable injuries is that they're preventable. This is a problem we can fix. There are little things we can do so kids can grow up to do big things. Learn more at safekids.org.
Take care, Grandma.
Okay, baby. Don't forget to let me know the second you get there.
Yes, ma'am.
My grandson always tells me I worry about him too much. And of course I do. I'm his grandma. Well, I was worried sick when he came home from Afghanistan. He came back wounded. It wasn't a wound you could see. It was a wound inside. Post-traumatic stress disorder. My T couldn't sleep. He was angry all the time. He felt like he didn't fit in anywhere. Then I heard about this group, Wounded Warrior Project. People helping warriors like T. So I figured who better to help my grandson than people who could understand what he'd been through. Now, I don't know what they do there, but my T is smiling again. So I figured they must be good people.
1 out of every 5 warriors return from the battlefield with post-traumatic stress disorder. Help support them at woundedwarriorproject.org.
Hi, this is Gordon Deal. Join me weekdays for This Morning, America's First News. Hear the stories you'll be talking about and searching for all day as we go beyond the headlines and above the chatter with your first look at breaking news, money, Washington politics, technology, entertainment, entrepreneurship, and sports. We explain why stories matter. That's why we are referred to as the most important and relevant radio program. America's First News, Monday mornings, 7 to 9 a.m. on Talk Radio 640 WGST.
Indeed, that is where your dial is set. Talk Radio 640 WGST. About 10 before 4. Every Saturday between 3 and 4, brand new programming. I'm Rob Scott. Across the room from me is Ben Chodor, your host of Health Tech Talk. And nothing goes on the air without a little help. We want to thank the gang at 1-800 Public Relations for all their PR and media support. Ben, so far I'm like blown away all the stuff you've brought to the table. And just for the folks who don't know or just tuning in or have never, heard of this show before, Health Tech Talk is...
It's where healthcare, technology, and science collide, right? So each week we're going to bring you the titans, the innovators, the companies that are making a difference in the healthcare, science, and technology space. You're going to hear about products. You're going to hear about companies. You're going to hear about startups. You're going to hear about publicly traded companies, and it's going to be amazing. And each week, if you learn a little bit and find that there is some scientific technology out there that's at your fingertips, that's my goal.
And a plethora of guests. You had two in the first half hour, and on the phone with us is Todd Johnson from HealthLoop, right?
Yes, and I'm really excited. So Todd, it was a great first segment, but I just want to segue a little bit before we hop back into HealthLoop. All right, you're a serial entrepreneur. You've had successful exit before. What attracted you to joining HealthLoop and moving your family from Maryland to the West Coast?
It's a great question. Going to start into a startup is sort of like going to war. And when I had successfully exited from my first one, my plan was actually to take my family, my wife and two young kids, and spend a little downtime up in the Northeast. And I found myself sitting in front of a gentleman named Dr. Jordan Schlane right outside the White House. And I was sort of meeting him as a favor. And over the course of about 45 minutes, I got to meet an incredible individual who had this vision, this concept of HealthLoop, and he had built a prototype because he had lost one of his patients, and HealthLoop would have let him know that something was going wrong.
I just wanted to interrupt you for 1 second. So Jordan started the company basically because he lost a patient because there wasn't that connection after they left the office. I mean, that's mind-boggling to me, but really, really, cool way for a company to get started, and for a very sad reason.
Yeah, and it's actually a story worth maybe telling a little bit. So to be clear, he didn't lose her; he lost track of her, and he had a patient with a typical pneumonia. Put her on an antibiotic and told her that these things generally clear up in 3 or 4 days, and if she wasn't feeling better, that she should call him. And he got the call 7 days later from the intensive care unit at Cal Pacific Medical Center, and she was on a ventilator, in respiratory distress, and almost dead. And they saved her, but his first question was, my goodness, why didn't she call me? He gave her his cell phone number, and it was easy. But the second very obvious question, shame on me, why didn't I call her?
Right.
And so HealthLoop can call, check in with every patient every day.
So it makes it a two-way street, right? It's not just the onus of the patient. It's not just the onus of the physician. It allows it all combined and make it automatic. So, which leads me, I want to go back to your answer, but I also want to tie in a little question to it. So, if I'm a patient right now and I'm looking for a physician, I would almost think, like, I don't know if I want to go to a new physician who doesn't have something like HealthLoop in place. So, where is my interaction with that physician going to be after I leave? Because it's not just about going to him anymore and getting me to feel better. It's about where's that connection going to be. Am I in the right ballpark?
Ben, it's a perfect point, and I would actually implore your listeners, people you're out there that have serious medical issues, or you have loved ones and family members with serious medical issues, I implore you to talk to your doctors about these types of digital platforms, these engagement tools that can actually get you a better outcome. Talk to your doctors. They need to hear it from you.
Right? Outcomes. It's about outcomes, and that's amazing. So if a patient walks into any of their doctors or anyone listening to Health Tech Talk, right, anyone around the world listening to iHeartRadio or locally listening to 640 WGST, so they can actually go into the physician and say, hey, you know, I heard about this company called HealthLoop. And then that physician, what do they have to do to get involved? Is it really complicated? Is it insanely expensive?
You know, it's not, and we can get practices up and running now in 60 days or less, and all you got to do is reach out to us. So we encourage both patients and doctors, download our app. If you're not on, if the doctor isn't on, there's some tools there that can help you to get on, and we just think it's an imperative. And physicians out there, I think what we're seeing is 2014 felt like a year where everybody's trying new things. And 2015 will undoubtedly be the year of really big change in this digital health economy. And so for physician groups, large and small, there's going to be leaders out there and there's going to be followers who lose market share. The time is now. The time is now.
The time is so now. All right, so I only have a couple more minutes left with you, and there's so much I want to ask you, so I'm not going to get to everything. But one question I do really want to ask you is, what do you expect over the next 12 months? What is something really exciting going to happen from HealthLoop? What do we have to look forward to? The apps are really cool, and you're getting more and more physicians on board. But come on, treat my audience to something special.
Yeah, so we've been, as an organization, just blessed to, again, I feel like we're in the right place at the right time, but what's even better is we're working with some of the best people on the planet, some of the most forward-thinking academic medical centers and integrated delivery networks. And as I said, 2014 is the year of trying, and 2015 is the year for big events. And we've been powering up some very large studies that are looking really at the three sort of triple aim goals of the Affordable Care Act are, you know, driving better outcomes at reduced costs and retaining patient satisfaction. And I think what we've proven is we can deliver on all three fronts by having patients and their doctors highly engaged in between visits. So I think we're going to see a lot of definitive research come out that says these interventions almost should be mandated because of the quality improvement both in the patient experience and the outcomes that we're seeing. There's no excuse not to be using them.
Todd, that is amazing. That rocks. Any last piece of nugget you want to give my audience? What should patients be thinking about out there as they're looking at their health care?
Yeah, I just think that patients should feel almost entitled to this, that there are now tools, there are technologies that can help them get better, faster, easier, and they should be talking to their doctors. And if you've got a loved one who's sick or injured, or if you are sick and injured, I think it's time to start asking the questions. Change is going to happen really fast, and here in Silicon Valley, we're seeing an enormous amount of movement from the venture community, from the startup community, and it's going to be fun. It's going to be fun. And so it's a great time to get involved. And even if you're, you know, going through a simple acute episode as a patient, you're entitled to this too.
Todd, I loved having you as a guest. I'm a big fan of HealthLoop. Nothing but success this year for you. I have a few seconds to say thank you to my first show. I want to thank everyone from Oxygen for being on, everyone from HealthLoop. And I also want to thank Rachel, Matt, and Bridget from 1-800-PR for putting all the guests together. I want to thank Rob and Alfred and Tom and everyone at WGST 640 Radio and iHeart family. I am really excited to be part of the iHeart family and the 640 WGST family. I want to thank my wife and kids. Without them, I wouldn't be doing any of this. And once again, if you're interested in healthcare and you're interested in the science of healthcare, Health Talk will be here. Health Tech Talk will be live every Saturday from 3 to 4 p.m. You can't wait to next week, and thank you. We're out of here.
We are out of here, Ben. Thank you very much. Health Tech Talk every Saturday, 3 to 4, Talk Radio 640 WGST. Have a great weekend, sir.